Hey everybody, in today's video we're going to be beginning a series on the condition of arthritis. Now, what you're going to find out in the beginning of this video is that there are many different types. Some of you may have heard of these before, some of you may suffer from these and maybe didn't realize that they're part of a larger group of problems. You may have been told what you have by name and don't understand that it actually comes under the arthritis family. And hopefully what we're going to do over this series of videos is explain them in a little bit more detail so that you can understand your condition a little bit more, or maybe those of others around you, to just spread a bit of awareness on the subject, because it is very complex, it is very debilitating in certain cases, and the more you know about it, the more you can hopefully manage it and assist others. Okay, so let's go through the types first of all. Now today we're only going to focus on two because I don't want to bombard things too much. There's a lot of information to digest, so we'll do it over the series and we'll go through which ones we're going to do in a minute. So first of all, we have Ankylosing Spondylitis, which is a condition that you probably haven't heard of it unless you have it or know somebody that does, but we're going to go into that one on another video. Gout. Gout is a part of the arthritis family. It's usually known as the disease of the decadent and the indulgent, a rich person's disease, if you will, but it's becoming more prevalent now that our lifestyles and standard of living has increased. Juvenile idiopathic arthritis is something that comes in, obviously, juvenile, so during infancy and through the junior years. It tends not to last into adulthood, but it can cause lasting effects depending on the severity of it. So this is something that you may find you have and then you grow out of, but it doesn't mean it's not going to completely leave you unscarred, for lack of a better word. Osteoarthritis, the one that we know, and this is one of the ones we're going to talk about today. And then we've got psoriatic, which is if you have psoriasis, it can cause arthritic problems because it is an inflammatory disorder, and that's obviously what arthritis is. We also have reactive, which can be caused by diet or certain chemicals or exposure to certain elements that will cause an arthritic reaction. We have rheumatoid, which is the other one we're going to talk about today, which is the autoimmune version of arthritis. And again, osteo and rheumatoid are the ones we know most commonly, which is why we're going to do this one first, just to kind of get everybody used to the topic. And then we have septic arthritis and thumb arthritis. So the thumb is a very interesting joint as it's very different to your fingers, and septic can obviously be caused by an issue with sepsis, etc. So let's now dive into the definition of arthritis. Again, these are all from the Mayo Clinic. Okay, so what I intend to do is take that information and make it slightly more understandable for you, but not to diminish the severity of things. And I know for some individuals you're probably going to find that this is maybe reductive to your symptoms, but this is more just to help you understand the things you may not already know and to help others understand it better. So, bear with me, and as always, if there's any questions or you want me to dive any deeper on these, then please do. I'll be more than happy to do so. So the definition is the swelling or tenderness of one or more joints. Okay, so that's a definition. That's how you would begin to tell if you maybe had an arthritic joint or joints. Okay, symptoms. Again, this is very different depending on the person and the type of arthritis and the duration of how you've had it and the following up effects, which we'll go through from these two later on. Pain, stiffness, swelling, redness, and decreased range of motion. Okay, so pain and stiffness, yep, we understand that one. The swelling and redness can be because of the inflammatory nature of arthritis, depending on which one you have, especially if you have rheumatoid arthritis or reactive, things are going to blow up. You're going to see a lot of visual cues that it's happening because your joints are going to become very red and inflamed and may swell in size. Okay, so that is quite a good indication that could be it. General pain and stiffness comes in, it's one of those ones that doesn't go away with movement. Okay, it stays painful and stiff. It's not like you've been sitting down for too long and you feel like you've seized up and you get a bit of fluid into your joints, as we spoke about on one of the previous videos with tissue damage. Obviously we need to get liquid and fluids and blood into those joints to keep them moving, so it'd be a little bit different to that. And decreased range of motion. You are now no longer able to fully move the joint. So with people with it in their fingers, they are no longer able to fully either flex or extend the finger. They're usually stuck here. They aren't able to extend anymore because it stays in a flex position. If it's in your arm and elbow, you may not be able to fully extend out and create a lockout position. Same with knees, same with hips and shoulders, etc. That it's going to limit your end range of motion. It can get worse as it goes on, but in the beginning, that's where it's going to make things difficult. Fully making those expressive movements through the joint like they should do, it's going to become rather difficult. Risk factors. Okay, so family history. If you have a family history of arthritis, like most things, it's something to be aware of. There's no guarantee that it will get passed on, but if grandparents and parents and relatives have had it, there is a chance that you are more likely to get it yourself. Age. The older we get, depending on the type of arthritis, obviously in osteoarthritis, which we're going to talk about today, age does play a bit of a factor. The older you are, the more likely you are to potentially have issues with arthritis, because quite simply, the older you are, the more you've moved your joints. The more you've been exposed to things, the more you may have played sports, etc., etc. These are things that are going to cause issues with joints and could cause arthritic problems. It's just unfortunate. The longer we are on the planet for, the more problems that may come along. So yes, you can avoid it by looking after yourself, but don't beat yourself up if you get into your middle 60s, 70s and you start getting arthritis. It's one of those things sometimes, unfortunately. Sex. Now, male or female, if you are male, you are more likely to get most of the other types of arthritis. If you're female, you're more likely to get rheumatoid. Just the way the statistics work, we're not entirely sure why. But yeah, men tend to get more of the other types of arthritis. Osteoporosis is something that may lead to osteoarthritis, but it's not the same thing. Osteo just means bones. So don't confuse the two. Osteoporosis is a problem that women get over men, but osteoarthritis is actually more common in men than women, because in general, based on statistics, obviously statistics change over time, men do more physical jobs, more contact sports, tend to play more sports in general, so we are wearing through our joints quicker. But rheumatoid arthritis, the autoimmune disorder, tends to affect women more. Joint history, as we said before, if you play contact sports, if you are a runner, if you are a swimmer, if you are somebody who's done sports from a very young age, you have been putting your joints through lots of stress for a long period of time. You may have an injury, you may have misaligned a joint, you may have impact injuries and injuries of cartilage and ligaments in the limbs. These are all going to compound together and maybe add to the arthritis coming forward. Okay, so just be aware that your joint history could be a factor as well. And obesity. Obesity is a subject in itself. It is a mental health disorder. Obesity isn't just something that lazy people become. There is problems with it, but the heavier you are, the more stress there is on your joints. And this, again, obesity doesn't necessarily have to be because you are carrying too much body fat. Again, just the heavier you are, the more stress your joints have to go through. Now, if you are in the obesity category because you are carrying a lot of muscle mass, so obviously obesity, if we take it in its BMI sense, just means you're over a certain amount of body mass. Therefore, you can be in the obesity category if you have too much muscle mass, although you're a healthier version of it. But again, carrying all that extra weight comes with its own problems. In one way or another, your joints are going to take more stress, your cartilage is going to have to support more. This is going to have a degenerative effect on the joints in general. So obesity, and more importantly, weight in general, will play a factor in this. Okay, so these points aren't going to change throughout the series, but it's something we'll keep retouching on just in case. So the two types we're going to talk about today: osteoarthritis and rheumatoid arthritis. So we'll start with the first one because osteoarthritis is the one we tend to know the most about. So we'll dive in there. Generally caused by wear and tear damage over time to a joint. Okay, as I said before, the longer you live, the more sports you play, the more physical your job, the more likely you are to develop arthritis in any particular joint, because it is generally a wear and tear issue that comes with the grinding down of the cartilage and the ligaments, etc. So as I said, the next point is cartilage breaks down and no longer prevents bone-on-bone contact. So, as we spoke about last video with the tissues and injury types and recovery times, remember that cartilage is avascular, okay? It doesn't have a blood supply. There is a fluid supply, but if that cartilage wears down, it doesn't repair itself. So eventually over time, what happens is these very slippery, smooth pads in between the bones on the joint will wear away, and then there's nothing stopping bone-on-bone friction, okay? In the sense of a knee replacement, if you completely have no cartilage left in your knee and you're having very bad arthritic pain in your knee, what they will actually do is skim off the top of your knee and the bottom of the femur and the top of the tibia, and they'll put metal plates on top with an extra pad inside so that grinding doesn't happen anymore. So that's what a knee replacement actually is. But when we get to the point where cartilage is breaking down, in any joint that has a movement, all joints have cartilage, every single one. And if that cartilage breaks down, it has been worn away, it has been damaged, it is deteriorated, you will then get bone-on-bone contact, and that will cause splintering, which is where the pain and arthritis comes from, as the bones start wearing down on one another, okay? And obviously, the older we are, the more sports we've played, the more damage we've taken, the more likely that becomes. It also causes changes to bone and joint structure. Now, as we've said, if wear and tear damage to the cartilage cause then cartilage to break down and no longer prevent bone-on-bone contact, depending on where the cartilage on the joint breaks down, if it's even, you'll tend to get an even wear. If one side breaks down, then as that breaks down, the joint itself, if it was normally here, will begin to tilt on one side, because if there's still cartilage on one side and this side's worn away, the bone structure changes. It then can cause damage to the ligaments, because one side is going to become strained and the other one isn't, and it's going to wear on one side or not. So again, the osteo part of osteoarthritis can cause other complications depending on how or where that cartilage has degenerated, okay? So don't be surprised if you start having problems with arthritis and you find that things don't look like they line up anymore, or you get secondary pain through adaptations made as the body's trying to figure out what's going on. Rheumatoid arthritis. Rheumatoid arthritis is, no arthritis is fun. It's not, but rheumatoid arthritis it's a nasty one because it is a chronic inflammatory disorder. So rather than osteoarthritis where it's going to come over time, you're going to more likely get osteoarthritis later on down the line in age. Rheumatoid arthritis will catch you at any point the body decides to start fighting itself, which essentially is, as we'll go into a minute. So a chronic inflammatory disorder can affect more than joints. It can also affect skin, eyes, lungs, heart, and skin again. Because it's an inflammatory disorder, it attacks tissue. It's not necessarily just going for the joint, it is actually going for the tissue that surrounds the cartilage. So if it finds familiar tissue elsewhere, it will also attack that as well. So be aware that it may not just be your joints that are affected. And with some of these other arthritis family as well, it's not just the joint that gets affected, especially if you look at psoriatic arthritis. Psoriasis is a condition that affects the skin and all your joints as well. So it's not always internal. It is an autoimmune disorder that causes the body to mistakenly attack the lining of the joint cartilage that can lead to bone damage and joint deformity. So, as we said, because it is an autoimmune disorder, it means your body is confused and is attacking the membranes and the linings of the joints because it thinks it's a foreign body, which is what any autoimmune disorder basically means, that the body thinks that this particular thing it's attacking is a foreign body and it needs to get rid of it. So your body is fighting itself. We don't know why bodies do it, but they do. For all their wonderful tricks and traits, bodies can also try and destroy themselves. Unfortunately, is the way it goes. So again, because it's autoimmune, therefore it's something that's caused inside the body, and it's chronic and inflammatory, it does cause a lot of problems. Bone damage, basically because where it attacks the lining of the cartilage, the cartilage then becomes weak and unprotected. It can wear down, and that causes bone damage. As we found, when the cartilage breaks down, bone-on-bone contact occurs, and it can damage the bone. And also joint deformity, because it inflames the joint and attacks it, sometimes it does become very hard and joints can be fused. You'll tend to see it in people with it in their fingers. They have incredibly large sort of bulbous areas around knuckles, and their fingers don't completely open out anymore. So it can deform joints as well. It's a nasty condition, and the trouble is because it does. So osteoarthritis, once you have it, you tend to have it, and you'll learn to go around it. There are surgical procedures that can help. There are medications that can help rheumatoid arthritis, but it's not like osteo where it is a simple, things have worn down, we can either replace, they used to do, I don't know whether they still do it now, gold injections as well to coat the layers to stop the rubbing, etc, etc. Rheumatoid arthritis will attack at times. Stress can lead to a flare-up, certain foods, because again, it can also maybe come under reactive types of arthritis, but this will come and go, and it's incredibly painful and acute when it happens, and it doesn't necessarily follow a linear pattern either. So just be aware of it. So that brings us to the end of part 1. Now, the next video, we are going to look at ankylosing spondylitis and gout, just because we'll move down the list. And if you have any questions in the meantime about the two that I've spoken about, or you feel like you might be suffering from it and you want some help and advice, please feel free to reach out, and I will do what I can to help you as always. And we can always add more in the video series if we've missed things out, because if you are living with it, you are the expert, not me. And if there's anything you want me to go into further detail on or research for you on your behalf, just ask and I'm happy to do so. Speak soon, guys. Take care.